The point of this video is to teach someone how to be standing on a balance board while catching a ball. This is a skill that is beneficial to someone who is having balance problems, either because of an inner ear injury or some other knee, lower back injury. Mastering this skill is a good way for them to then practice their balance and hopefully help improve in their balance.
Christine here is demonstrating balancing on the ball. There are a couple critical factors. The first one being that her weight has to be centered on the balance board so that she can keep it stable. The other one being she's got to catch the ball with her hands and she's in an upright position. There are quite a few flexible factors as well. Where her feet are positioned on the board is flexible. They can be further or wider apart depending on how she feels comfortable. Her arm position is also a flexible factor. She can choose where she likes to hold her arms, and then which hand she catches the ball with is a flexible factor. It could be your right or your left.
Catching a ball while on a balance board falls under the 3B category of Gentile's taxonomy. This skill involves body stability because your body is not in motion. You are manipulating the ball by catching it with either your right or left hand. Regulatory conditions are in motion because the ball is thrown towards you in order for you to catch it, and no inter-trial variability is involved in this task.
To make sure that you're ready to be using a balance board, we have 3 different simpler tasks that you need to make sure you can do before using the balance board. The first one of those is just standing. It seems pretty simple, but if you're having balance problems or an injury problem, you should make sure that you can stand on both legs perfectly fine without any issues. To make that a little bit harder, make sure that you can stand with your eyes closed. Again, pretty simple, but closing your eyes can throw off your balance, so just make sure you can do that. And then to make that even harder, if you have no problem closing your eyes standing, make sure that you can stand on one leg. If you can do that without any problems, you can do the other leg too. Then you're good to go, and you can go on to the next thing. Just standing fits into the 1A category of Gentile's taxonomy.
The next step in achieving the end goal of capturing a ball on a balance board is being able to stand on the balance board by yourself. This step falls under the 1B category of Gentile's taxonomy. Once you're able to maintain your balance without falling over, you can make this task more difficult by closing your eyes and holding it for 10 seconds. To make this task even more difficult, you can do squats while you're on the balance board, like this. Once you're able to do 3 sets of 5 reps with no problem, then you are ready to move on.
The next task you need to be able to do is to catch a ball. This falls into the 3A category of Gentile's taxonomy. If you have no trouble just catching the ball at least 3 times in a row, you can make that more difficult by catching the ball when it's coming at you from your peripheral vision. If you can catch the ball out of your peripheral vision at least 3 out of 5 times, then you can make it even more difficult by trying to catch the ball with one hand while standing on one leg. This is going to really work on your balance to make sure you're ready to be catching the ball while on the balance board. Once you have mastered being able just to stand on the ground, balance on the balance board, and just catch the ball while on the ground, then you're ready to move on to standing on the balance board while catching the ball.
Here's a demonstration of the skill. Make sure you are balanced on the board before the ball is thrown. The ball should be thrown about the same each time. Mastering and practicing this skill will definitely help you improve your balance. What we have here are a few important tips for you to keep in mind when you are practicing this skill.